Save it or redo it. How we make that call. The dividing line on what implant is savable and what's not is what is showing in the mouth. We know the gums like smooth. Gums need smooth. The bone prefers it to be rough. If there's any implant showing, we have the option to polish that implant and get it as smooth as possible to where it can go through the gums without attracting plaque. Plaque is the #1 step in every oral disease, any gum disease, decay, everything. Plaque is the first step. So if we can get it where there's no plaque, where you can clean it appropriately, the implant is worth saving. Even if there's 4 millimeters in bone, if we can get it smooth enough to where when you brush your teeth, it gets cleaned, it's worth saving. Sometimes it's in a situation where there's no amount of polishing we can do on it to get it where it's cleansable. And if that's the case, we advise taking that implant out and just starting over, utilizing bone elsewhere to restore you.